aftermath of the conflict that engulfed South Sudan, a surge of refugees flooded into the West Nile region of Uganda, seeking safety and refuge. The Bidibidi, Imvepi and Yumbe hosting communities bore witness to this humanitarian crisis, prompting the Uganda Red Cross to initiate a transformative project, the long-term safe water coverage for Bidibidi, Imvepi and Yumbe hosting communities, abbreviated as BIMYSAWA. Building upon assessments from prior projects funded by the Austrian Development Agency through the Austrian Red Cross in Yumbe and Imvepi refugee settlements, BIMYSAWA emerged as a strategic response to meeting the escalating needs of the growing refugee population.
BIMYSAWA is a project that its main objective was to release, to have the communities, the refugees and the host community improve their livelihood and dignity. And this project is implemented in Bidibidi, Imvepi and Yumbe refugee settlements.
With over 1.4 million refugees hosted by Uganda, the project set out with a clear mission to safeguard the lives, health and dignity of refugees and their host communities. The specific objectives are targeted improvements in living conditions, focusing on access to safe drinking water, sanitation services, waste management and menstrual hygiene management, and branch development.
The project has been implemented in the Bidibidi refugee settlement, that is Zone 3, Zone 4 and Zone 5, and in the host communities of Gobora and Kerwa. With the main goal of provision of safe water for the refugees and then the host communities, and then improvement menstrual hygiene management, and then hygiene promotions, both in schools and then in the communities as well.
The BIMYSAWA project made significant strides in achieving its goals. Water sources were solarized, tap stands were repaired and constructed, and water supply systems were expanded to ensure 35,000 people in priority areas gained daily access to safe water.
We used to move up to Keti to fetch water from there, and that water is even not clean. They have been used by animals. My children even if all sick because of dirty water.
Fecal sludge and solid waste management were enhanced in Imvepi refugee settlement and Yumbe town, benefiting 10,000 individuals.
We have schools, a lot of institutions in this settlement, around 13 to 15, and of which you can find one school has around 7 blocks of latrines. Now the question was like, when these latrines get full, what should they do? Should they just close it? And that's why we had to come up with this treatment plant, so that we can cut down the costs of transporting fecal sludge. And also to make sure that most of these schools' latrines are operational, so that they do not close latrines every time they are full.
Here at the Fecal Sludge Treatment Plant Center, we do a lot of activities. We deal with the treatment of fecal sludge. Fecal sludge to a layman is feces. That's what I would put it in a simple way. We try to treat these feces to see that it is environmental friendly and safe for redisposal. And then we also try to safeguard against public health. That is the main function of this treatment plant. However, we have other components, experience with solid waste management. So we also double and try to ensure proper management of solid waste at this treatment plant.
But the focus in the refugees was a big challenge, and now us having this facility with us in Imvepi, first of all, is a learning area for research and improvement. Secondly, is also supporting refugees who are in here and those who may come, to support them in handling fecal sludge issues, because it's a big area of disease outbreak. So if we manage, another thing is also income generating activity for the people of Interrego, as well as refugees of Imvepi, as well as also URCS, because with the technical experts we have, we are now having receiving contracts, receiving sludge from different drainable latrines that we have.
Empowering girls and women through menstrual hygiene management essentials and soap production was a cornerstone of the project. Training sessions, radio talk shows and the distribution of hygiene kits not only improved the lives of people but also contributed to the broader goal of enhanced hygiene behavior.
Our main focus was majorly on how to ensure that these adolescent girls knows how to take very good care of themselves during menstruation, while looking at the various menstrual hygiene management products that are in the market, looking at the facilities that are very good for menstrual hygiene management, and then also looking at the roles of the key stakeholders in proper management of menstruation. And then we also focus so much on how to make reusable sanitary pads.
The situation before receiving this menstrual hygiene kit, it was a very hard situation that we as girls, we really suffered because all these things were not there. And when we are going through that situation of menstruation, we really lack very many things. One of it is the pad and the fans. When these things are not there, it is hard to us as a girl to feel comfortable or to feel good.
After receiving the kits, I've realized a lot of change. The dropout rate has reduced to a greater extent. There is that confidence in class. Like if your period comes and you realize that it has come, you quickly go to the teacher in charge. She helps you to how to manage yourself. You come back when you are comfortable. And you don't miss classes. Absenteeism has totally reduced as a result of the distribution of the kits.
Under the pillar of community hygiene and sanitation promotion, the project thrived through the dedication of volunteers. The project's training initiatives, embracing a participatory hygiene and sanitation transformation methodology, reached households, fostering improved hygiene standards. Moreover, a comprehensive approach included training volunteers and staff to integrate protection, gender and inclusion into daily wash activities.
The project had 25 volunteers, and out of the 25 volunteers, 10 were female and then 15 were male. And all these were community-based volunteers that were attached to the schools and then the communities that we were working in. And these volunteers, they supported in hygiene promotions in both schools and communities, ensuring that the schools are very clean, the latrines, the washrooms, and then the water sources are very clean, which was very good for the learners.
As the lifeblood of sustainable development, water supply was a focal point of the project. The project solarized water sources, repaired tap stands and constructed new infrastructure, ensuring a daily supply of safe water to priority areas.
Under water supply, we had solarization of 3 water sources, taking them from the gen type to the solarized way of pumping. Then secondly, we also had a contribution in the construction of a distribution line for a Kera water system, where we made 15 tap stands plus a distance of distribution line of about 10 kilometers.
So when our partners, the UNHCR, and that is the United Nations High Commission for Refugees, and the Water Mission Uganda, which is the implementing partner for UNHCR, came to us and informed us of the gap that was existing, that they were having difficulties with providing the required per capita of water for people, which was being caused by the irregular pumping as a result of lack of fuel for running the generators. So we looked at the viable option, and that was to improve on the facilities that were existing. So we decided to solarize 3 systems, one in village 1, another in village 2, and the other in village 3 of zone 4. These systems before were run by generator, as I said earlier, but now we have made them hybrid. They are now run by both diesel fuel and then by solar. In each of these systems, for example, this is village 2, we have installed 20 panels of 280 watts each. So that one provides us with 5.6 kilowatts of power, which is used to run a 4 kilowatt pump, ground force pump. And then this, we pump water to a reservoir of 20 cubic, that is 20,000 liters capacity. So 2 hours, in 2 hours we pump water and this 20 cubic is filled up. However, it depends on the usage also. The more the number of users, the more we shall keep on pumping. So this has helped us to reduce on the effect of not having enough water for the population. So right now, we can say all the 3 villages, that is village 1, 2, and 3 of Zone 4 Annex, are accessing the required per capita of water that is required.
You know, we're living in a district where the population is growing rapidly. Therefore, the demand for water and sanitation services are immense, meaning that each year that demand keeps multiplying itself. So as we talk in relation to water, we are at 49% before you came. And I'm proud to say that your interventions have given us an impact. We are now proudly talking of 50% access to safe and clean water. In terms of sanitation and hygiene, of course, latrine coverage stands at around 82%, if I'm not mistaken, at the moment. But some 1 or 2 years back, it was in the 60s, 50s there.
But as far as provision of safe water sources concerned, government, together with the efforts of other partners like Red Cross, we think we are progressing very well.
As the BIMYSAWA project unfolded, its impact became evident across the Bidi Bidi and Imvepi refugee settlements. The once dire situation has begun to shift, with basic needs being met and the groundwork laid for a more stable future. The resilience of those affected and the strategic efforts of the Uganda Red Cross, supported by the Austrian Development Agency, mark a turning point in the ongoing humanitarian challenges. While challenges persist, the tangible progress witnessed in these settlements stands as a testament to the practical and effective measures taken to address the pressing needs of the refugees.